5 on your health. A child in Oregon is the latest to test positive for monkeypox, bringing the nationwide total to 9 pediatric cases.
And obviously 9 in a country of 330 million, the number seems small. But parents know that one case is one case too many. Here to answer your questions is Dr. Scott Hadland, is the chief of the Division of Adolescent and Young Adult Medicine at Mass General for Children. So, doctor, what do we know about the risk to kids from this virus?
Well, thanks so much for asking that question. You know, I also am a parent of 2 young kids, and so I'm keeping a very close eye on this as well. On the one hand, you know, I think parents are alarmed about this, and rightly so. They don't want their kids to get infected. On the other hand, as you pointed out, the risk remains quite low. There have been 9 pediatric cases among more than 30,000 across the country. So the risk at this point is, you know, less than 0.1% of a child being infected right now.
Doctor, we appreciate your time and thank you for being here. In some of these cases, it's still not clear how the children got the virus. So school's going to start up again. You said you're a parent. Kids are getting back into a routine. So what should they keep an eye on? It's overwhelming. When we were talking about this last year at this time about COVID. Now we're talking about monkeypox, and it's a lot for parents.
It is. You know, it can feel relentless, sort of having to worry about one thing after another in the era of COVID. You know, I'll say this, we're really looking out for abnormal rashes as a sign of monkeypox. Again, the risk is quite low. And, you know, there's actually plenty of viruses that can cause rashes in young children. And so this is going to be difficult for parents to understand. What I would say is it's never the wrong answer to call your pediatrician or family doctor and bring your child in and have them examined. Because if there is a risk or a question, then they can get testing.
There's never, that's never wrong, and it's obviously right now, that's reality. That's our life. That's where we are right now. So we would love to talk about a study that came out on Friday showing that nearly 30% of children who were hospitalized for the COVID or any related condition had symptoms more than a couple of months after the diagnosis itself. So is there some good advice for how long parents should be watching for issues after a child tests positive?
Well, again, in the era of COVID, it feels like it can be relentless. These viral illnesses can be really confusing. And in fact, you know, after a child gets over COVID, they might have lingering symptoms, as the study showed, or they might have acquired a new virus if they have new symptoms that come out of nowhere. And so again, you know, bring these questions to your pediatrician. We can help navigate this stuff. I will say that vaccines are very important here. We know that vaccines can prevent serious illness, and it's really serious illness that's linked to these long lingering symptoms. And so if parents want to do what they can to prevent this in their kids, one of the single most important things they can do is get their kids vaccinated against COVID.
Dr. Hadland, great to see you. Thanks for your time.
Thank you, doctor. Stay well. Great job. We appreciate you.